In this video we will be showing you a great exercise to release tension from your tennis elbow and stiff forearm. Tennis elbow is really annoying because it affects everything you do daily with your hands, using a mouse, grabbing something, doing your weightlifting or your sports. Everything can be really painful if you have a bad case of tennis elbow. So stay tuned for this magical physio trick. Hi, my name is Markus. I'm a licensed physical therapist from Finland. Tennis elbow is a name for the symptoms that occur in your lateral elbow forearm region, but don't be fooled. It has little to do with tennis. It's actually an overuse injury of the muscles and the tendons in the region, and it is caused by repetitive movements from your wrist or your elbow, or from sudden increase of loading in the region or the muscles. Our tried and tested protocol for managing tennis elbow in our clinic goes something like this. First, we need to examine what factors are part of your tennis elbow symptoms. For example, there might be nerve-related problems that mimic the symptoms of tennis elbow, and this is tested by testing tension of the nerves or the movement of the head. If moving your head or increasing the tension in your nerves replicates the symptoms, then there's a huge involvement in the nerves, of course. In this case, a huge part of the treatment is fixing your neck posture, deep muscles of your neck region, and also releasing the nerves and increasing the metabolism of the nerves. Then we should also assess the wrist movement, the elbow movement, and the muscles in the region. If the nerve tests and the neck test didn't reproduce symptoms, but the muscle testing did, then a big part of the rehab is load management. So limiting the amount of activities during the day with the symptom hand. So lifting stuff so that your palm is facing down might aggravate the muscles here and cause symptoms. Changing this to lifting stuff palm facing upwards might help. Also, grabbing less stuff with this hand, with the symptom hand, and assisting with the other hand might help at first, but this is only at the first stage. Also, if you go to the gym, use straps because grabbing like this or lifting like this might aggravate the symptoms. Also, if you do rows and stuff, then try to keep your palm facing upwards even though you don't grab anything, because this activates more of your biceps and less of your forearm muscles that are sore from the tennis elbow. For the rehabilitation exercises, you need a good combination of deep tissue release techniques and exercises that build load tolerance. These exercises increase metabolism in the muscles, in the tendons, but don't aggravate the symptoms. And this, done gradually, builds the tolerance so that you can do normal everyday tasks without pain. These load tolerance building exercises are usually isometric static exercises, and this gradually builds and goes into hard, heavy, eccentric, concentric exercises. Next, we will show you the exercise that our clients use to reduce pain and release tension from these lateral muscles that are involved in tennis elbow. If you have medical reasons not to massage these tissues here, then don't do this exercise. Don't do these exercises on consecutive days. Keep a rest day or two between sessions. These tension points can get sore the next day after doing this exercise. This is completely normal. The soreness usually goes away in 1 or 2 days. Do this exercise again only after the soreness is gone. To start this exercise, sit down and relax. Put your hand on some surface that is in a good height. So put your palm facing down. Teemu will draw a circle, and the muscles that are in the circle are the ones that are suffering at this moment. And remember, it's not only in the forearm, it also goes a little bit above your elbow joint, but it's the lateral muscles. Remember also that in the next exercise there are different approach angles to these muscles. use all of them, or try at least all of them. Next, grab the body maintenance tool, the chosen one, Wilson tennis ball. In the same position, start to search for tight spots. Remember, I told you about the different approach angles. Try them out here. So when you locate a painful spot, then add pressure and start to friction massage it. This starts to release slowly the myofascial layers and releases tension. And now, if your hand is not too painful at this moment, then please use your hand to subscribe to our channel and like this video. Okay, let's continue on. So Teemu has now tried different angles and the pain starts to relieve in this spot. So what does Teemu do next? Teemu is smart and goes to the next spot, like this. Ow, ow, ow. It's painful, and now Teemu does this here. This can be painful when you do it, it's okay. You can cause pain with this exercise. It's not dangerous, and usually the pain starts to subside in 1 to 2 minutes. If it takes longer than 2 minutes, then just continue to the next spot. And when you start doing this regularly, then the painful spots start to go away, or if there's as many spots as it was before, then usually they are not as painful as they were. You can also use another tool for the heroes of body maintenance, the stick. And with the stick is harder, so you might be able to go deeper with the stick. And now you can apply pressure and do this movement. Also remember to give attention to the spot above your elbow joint. Now if you want to get a good set of exercises to build load tolerance for the muscles involved in your tennis elbow, we might do a video series on it in the future, sometime, we don't know. But meanwhile, if you want to get a good set, you can go check out our new online course that has good exercises for this and also great exercises to release your upper limb nerves that go into your hands, also release neck tension, build and activate your deep postural muscles in the neck, in the shoulders. So definitely go check it out. Also, if you click yourself to the page, then there's also a free set of tests for the upper limb nerves, so you can check them out, do the tests and identify if there is nerve involvement in your tennis elbow. Thank you for watching the video. Hopefully you get lots of pain relief from this exercise, and we will see you on another video. Bye.